Welcome back to Chiro Philosophy Mixtape. This is your host, Dr. James Hopkins, aka Doc Hops. I am a licensed chiropractor, and welcome back to my channel where we react to what I like to call chiropractic commentary, and we get to it and give my honest and open opinion and 2 cents about different things on YouTube, social media about chiropractic, and yeah, I try to relate it to the bigger picture and give more nuance to the conversation, as a lot of things need to be debunked and explained with more clarity, I guess, when it comes to chiropractic, which is very misunderstood. So, uh, welcome back, and welcome back to the Aimee Esther series, as we covered the intro, part 1, 2, and 3 of the chronically ill influencer gets worse after upper neck adjustment. And this is part 4 of that series. And so I just want to say welcome back, and let's get into it. So, on the last episode, on the last couple episodes, going back to part 2, we talked about all of Aimee's chronic illnesses and everything she had going on leading up to her first upper cervical chiropractic adjustment, and what all of that means in correlation to her chiropractic care, if it has any correlation at all, and how we can piece this puzzle together of her case of being in a severe car accident 10 years ago to after 5 years, she experienced all these new things and conditions, and that just spiraled, which led to her going to an upper cervical chiropractor. We talked about what an upper cervical chiropractor is, who they are, and what they do compared to traditional chiropractic. And we also got to hear back from Aimee about what it was like after her first upper neck adjustment, as far as how she felt and the symptoms that came along with it. And we seen her in a neck brace, and so it's like, what the hell? What happened? Why is she in a neck brace after getting adjusted, after getting her neck adjusted, right? And also the fact that she didn't get a by hand neck adjustment. She got an adjustment by an instrument called Atlas orthogonal, the upper cervical chiropractic technique that we talked about in part 3, right? That carries a sound wave that moves the top bone in the neck with a sound wave, right? So how in the hell does a sound wave cause her to be in a neck brace, right? She's not supposed to feel nothing, right? Which is true, but the adjustment is powerful, especially the upper neck adjustment to the Atlas C1, first bone in the neck. It's super powerful because, like I said, the C1 and C2 complex surrounds and protects the brainstem, right? Which controls everything, right? So when there's misalignment in C1, C2, a lot of stuff can happen to your nervous system and your neurology and how you live your life, and to all these primitive things that are automatic through the autonomic nervous system, like breathing, blood pressure. All that stuff is affected by an upper cervical misalignment. And so we're going to talk about why she happened to be in a neck brace after her first upper neck adjustment. And yeah, we're going to get into it, guys. I hope you enjoy part 4 of this series, and I hope you've enjoyed it up to this point. And if you haven't already, like and subscribe to my channel and hit that notification bell as well to stay updated on new posts that come out. All right, let's get into it. All right, y'all. So, yeah, let's get into part 4. And I had to loosen up my hoodie because we're getting deep into it. So I had to get a little more loose. So let's get into this episode. So in this episode, part 4, we're gonna talk about a phenomenon in chiropractic, but especially upper cervical chiropractic, that a lot of patients experience after their first chiropractic adjustment or through their series of adjustments in their care plan that's not really talked about in modern medicine today. And I feel like it's not explained well enough in chiropractic either. So it's super important that I'm touching on it today. I found a post from uppercervicalcare.com, and we're going to talk about nerve retracing. Say it again. It's called nerve retracing. So what does that sound like? Okay, you got the nerves, right? And in retracing, what is retracing? Like going back into something, like re-experiencing something, retracing, like redrawing back to something. Yeah, that's exactly what it means. So our nerves are re-experiencing something that already happened. Yeah, yeah, that's what it is. It's part of the healing process that like I said, is not talked about enough, and conventional medicine has not always recognized it as part of the healing process per se. So we're going to talk about nerve retracing, um, and how this may be what Aimee is experiencing with all of her symptoms, as you've seen in part 3 of her saying how she felt okay after right after the adjustment, but after a while on her drive home, she started to experience nausea, dizziness, and it just kept getting worse. And how she said the front desk lady at the office she was at said she experienced vomiting and all that after hers as well. And so yeah, that's part of nerve retracing uh, after you get an adjustment. And it doesn't have to just be an adjustment to your upper neck. So it's your whole spine that deals with this. So what nerve retracing is, it tells you that healing is not always linear. Like, it's not always how we think. Like, oh, I got adjusted, so I should start feeling better. Like, yeah, but that's not. It's not that simple, right? Like, we're living human beings that have experienced a lot in our lifetimes, and a lot of us haven't gotten adjusted at all until we got in our adulthood, or after trauma, or a lot of people never get adjusted at all and never experience what nerve healing is. And so this is very important to talk about. And so yeah, so Aimee said she got worse after, and this was after New Year's. She said she went to a family function and she had to lay down, and it was just got better, but it was still not all the way better. She was still experiencing the dizziness and headaches and all that. And that, I feel like that is definitely a part of the nerve retracing process that she probably experienced at that time. And yeah, it is, uh, especially as a patient and a paying customer to chiropractic to get the service of getting adjusted. Um, I feel like a lot of patients have uh, given up on care because of this, and it can be a process that can be confusing and unsettling to the patient. However, it'll make you question if you're, you know, it'll make you question if you're truly getting better or not, and that's gonna lead to you doubting the chiropractor and his or her expertise. Is gonna lead to your own anxiety and doubt about even going to a chiropractor for help. Is going to lead to all that naturally, right? And so it's going to be hard for you to stay positive about your healing journey. And that's the whole thing within itself, mindset, right? So, so this is major to me because I feel like us as chiropractors don't explain this part enough. And I feel like this will ease a lot of people's own experiences about chiropractic who've experienced similar things to where you feel worse after you got adjusted. So that makes you look at the chiropractor like, what the hell did you do to me, right? So I totally understand that. So yeah, so let's talk about it. So nerve retracing. So retracing is a phenomenon that occurs during the healing process where the body revisits previous symptoms and illnesses and traumas that you've dealt with before, and it's part of the natural healing process. Or during the treatment of chiropractic, acupuncture, homeopathy, and like for example, when you watch on TV those natural herbal healing ceremonies, like with ayahuasca, how they start vomiting and start reliving a lot of past trauma. Yep, that's nerve retracing. Yeah, it's real. And so, yeah, like I said, like anything, any previous symptoms, illnesses, and traumas, and that's how we talk about in chiropractic philosophy and principles of the three T's: thoughts, trauma, and toxins. Hit that on the mark right there. Uh, of what's causing your vertebral, of what may have caused your vertebral subluxation at its source, right? And so the concept is, as the body heals, it's going to clear out any old injury and imbalances, right? It makes sense, right? And so it sucks for you, it sucks for us doing the healing, but we're going to temporarily be experiencing these old symptoms that are going to come back to surface. And it's our job to understand and accept that. There is no silver bullet shortcut to healing. If you want to heal for real, you gotta deal. I like that. If you want to heal for real, you gotta deal. It ain't no shortcut around that. Like, you can take an Advil, block nerve blocks, pain injections. It's never gonna heal anything. All those are just masking all the symptoms and injury and all that. You got healed, man. And so that's where we come in as natural healers in educating our people on what healing is all about, and how it may, even though it took your neighbor 5 months to get better, it may take you a year, you know. And so you can't say, oh, they're taking all my money trying to keep me under care. No, it just depends on your nervous system and what you've dealt with. It's gonna take it may take your nervous system and spine more time to heal than your neighbors or your husbands or your wives or your sister or your brother or whatever. It's just case by case basis. We're all different and unique in this world, and I hope that makes sense. So that's what nerve retracing is, and unfortunately, Aimee is experiencing all of that. And it's not just on a physical level; it's on a mental, spiritual level as well. As you experience past traumas that may have happened to you that have affected you on that mental, emotional level, you're gonna have to be present and patient enough to sit with that. And that's what's wrong with our modern society now, especially in the States, that we weren't taught how to deal with our own shit, excuse my French, right? And that's what I feel like we're at in the world, especially in millennials and Gen Z, as far as us dealing with our own stuff and really sitting with it and healing from it, and not just acknowledging it, but doing something about it for the long run, you know. And that includes, you know, getting adjusted, going to a mental health therapist or counselor, exercising, eating healthy. Is all of these things. It's not just one thing. And yeah, healing takes time is my whole point of addressing nerve retracing. So I hope that made sense. And yeah, that's what I feel like Aimee is going through in that neck brace. And so let's see how she's dealing with it. Let's continue to hear how she's dealing with it, and what she thinks is going on, and what her chiropractor has told her. All right, see you in the next one.
So now here we are, about a month after my first appointment. It's been up and down a lot. I ended up having to get adjusted the first 3 times, and then the 4th and 5th time I went, I was going twice a week. The 4th and 5th time I went, I didn't need to be adjusted, which is called holding, meaning my body was holding the correction. So basically every time I go in, it should be like this. If they've turned, he puts them back to where they need to be, and then over time, or if I like pick something up wrong, or like I sleep weird, then they pop back out. And then we have to readjust them, because my body for the past 10 years has been used to sitting like this, so it keeps wanting to move that way, and so he has to keep realigning it. I really thought it was more like you're here, and then every time we're gonna move it closer, but it's actually, they move it all the way back, and then my body moves it to where it used to be, and then they move it all the way back, and then my body relaxes. And then over time that happens less and less and less, because you're kind of training your body to keep it in this correct spot that it doesn't want to be in. So I had a couple where I wasn't, or where I started holding, and then I started not holding again, and I got really frustrated, and I thought, what am I doing wrong? I do have a baby, so it can be kind of hard. If you guys want a video about some of the things that my doctor has told me to do to help me hold, or more information, again, just let me know in the comments. I'm happy to share as much detail as you want to know. Or if this isn't making any sense, leave me all the questions, because there's just so much to it that maybe this makes no sense. But then after I was not holding a couple times, I asked him, like, what can I do differently? Like, am I doing something? Is it just my body? And he said, sometimes it's your body just naturally going back, and sometimes you are doing something wrong. And so he said most common is sleep. And so I ended up buying a new pillow, and I really think that's helping. My dog is drinking water below me, sorry. Anyway, so I got a new pillow and I started holding again. And so I'm really hopeful that if I keep doing the things they asked me to do, as well as sleeping better and being really careful, but also exercising and just doing all the things to help my body be healthy and heal, that I will be doing better soon. But it does not feel good to get adjusted. So the first few days, or the first few times I got adjusted, I shared some of those first few days and they were really bad. And then every time after that, it was not as bad as the first time, but still pretty bad. I would still be really sick. And I always knew. Before I'd go in, I'd know, because I'd get a really bad migraine right before, or I think probably right when I like knocked it out. I'd wake up with one, so that's why I'm pretty sure it was asleep, because I'd wake up with just the worst migraine, like worse than even before I started doing these treatments. Okay, I think I need to take my puppy out, so we'll wrap this up. But my migraines would get worse, and I knew I wasn't holding, and then I'd go in and yep, I wasn't holding. And then I'd have to get adjusted, and I wasn't able to lift anything for 24 hours, so I had to have someone help me with my kids. And it was just like, anytime I get adjusted, it is just the worst. It just feels terrible, and it makes me so sick. Like, I just feel like I have the flu, and it's just, it does not feel good. But the times where I am holding, I actually feel a lot better. I feel like my migraines are getting better. He said that because it was always misaligned, this shoulder was super tight, which I've always felt. I'd get massages all the time because of that, and all my migraines come up from this one shoulder. And he would work on this shoulder a lot. If I was holding, he would do this. It was like a big gun thing. I think I might get one for myself to help massage my shoulders and relax them a little bit more, but he would work on it a lot, and then because of that, it would relax those muscles, and then I would come out of alignment again. So sometimes I came out is because of that, but he said we have to do both. Like, it might throw you out of alignment sometime, but that's just how it goes. We have to relax those muscles, and then we have to realign you, and then it's just like a process to healing. It's going to take a while. But I'm about a month in, and that's kind of my update so far. It's hard to explain, and I know I should have been probably doing like a weekly update, because there's just so much that's been happening. But because so much has been happening, and because I've been just so sick with these treatments, it's hard to get my camera out and talk to you. So today I'm feeling really good. We're about a month in, but we'll see how the next little bit goes. So,
hey, welcome back. So that was Aimee talking about how she's been doing within her first month of care, going back from her first appointment of getting the first upper neck adjustment and all the symptomology, and how I talked about the nerve tracing and how that may be what was affecting her. And now with her within a month of her care, going into the next phase, which we like to call an upper cervical chiropractic holding of the adjustment, which is a process where you're going to go through of the adjustment not holding, and where life happens and it gets knocked out again, causing a misalignment, and you have to get your upper neck readjusted back to neutral. More specifically, C1 atlas, the first vertebral segment in the spine. And so that's what we call holding, simply holding. And so she talks about how she's gone through the process of what she has to do to hold her adjustments. And especially with her, they keep getting knocked out, and she's explaining that whole process. So she's making progress. So going from the nerve retracing to now trying to hold her adjustments now, and that's what I like, and that's what we call retraining as well. So and how she talked about it was how she thought it was, when you make a correction to that to Atlas, how it goes back to center, and she how it goes all the way back to center, right? And how she thought it went back into correction in increments, which isn't what happens. It goes all the way back to neutral. But when it gets knocked out of alignment, it doesn't go all the way back out to how it was when she first got treatment. It goes back out to what the spine can sustain at that point. So it's important for the patient to keep up with their adjustments. So every time they get a correction done, they have to be doing their homework at home, from stretching and doing those neck exercises as well to help strengthen their neck and stabilize her corrections, because you have soft tissue like ligaments and the muscles that have to get the retraining to help hold more secure those corrections. And so especially with her, and so being fresh to a cervical chiropractic, and so that's where she's at in that retraining process of holding her adjustments, and that's what's in her awareness now, and she's understanding that, where at first she thought she had a flip flop of when the atlas goes out, it goes all the way out. No, it goes it gets corrected in increments, but no, it goes out in increments. So however, what level you're at in that retraining will be what happens when the atlas does go back out. And so you don't have to start all the way back over. You're starting back to where your soft tissue and ligaments can sustain that misalignment, right? That makes sense? And so, and then she goes into talking about ergonomics, as far as like why she's not holding her adjustments, and because she has kids, so she's holding babies and whatnot, being a mom. And so, and she also said that her chiropractor said her sleeping, like she needs to adjust her sleeping patterns, and he told her to get a new pillow, and she said the pillow helped her hold her adjustments. So that's good too. Like she's making adjustments and improvements to her ergonomics and her sleeping patterns to get those triggers down and those variables out of the way, so she can hold her adjustments longer, right? And so, and then she goes into her chiropractor saying that he does the massage gun on her shoulders as well, but saying that the fact that it knocks out her alignment, it's like, why would you even use that if you know that this massage gun is throwing out her adjustments? And why would you tell your patient that? I'm sorry, I had to dig into him, because that's just counterproductive to her care, right? Like I said, it may work for somebody else, but for her case, I don't think she needs a massage gun, bro. I think, like, why don't you refer her to a massage therapist, or you massage, or you do hands-on massages that are less aggressive to her corrections, right? That just makes sense to me, but I digress, and but as a patient, I would be like, then why are you even treating me with the massage gun if it's throwing out my adjustments? Don't you think that's a bad idea? I'm just saying, but hey, I digress. That's what they do. Business models, right? All right, so yeah, so that's her. So good job. She is progressing in her care. That's awesome. And so, and a little segue from the massage gun here. When I was doing my research for this project, I found this chiropractor's blog post he made. It's from Boulder Chiropractic Clinic. Shout outs. And on his blog, they had a blog post titled Atlas Prophylax. No, Atlas Prophylax Lifetime Atlas Adjustment Myth Busted. I'll say that again. Atlas Prophylax Lifetime Atlas Adjustment Myth Busted. So